How does dizziness and vertigo cause falls? Hi, my name is Doug. I've been a physical therapist for 30 years, and I specialize in helping people with balance problems learn to walk again. One of the things I see very often in my patients is dizziness and vertigo. And a lot of times, that's the reason that the person is falling. In this video, what I'm going to talk about is how vertigo and dizziness can actually affect your balance and cause people to fall. And I'm also going to discuss a little bit of how you can fix it. There is vertigo, which is a sensation that either the world around us is moving or spinning, or that we're moving or spinning when we're actually standing still. There's a lot of things that can cause vertigo, and actually many people are surprised to learn there's actually hundreds of things. One is a problem with the inner ear. That's a lot of times what people believe is wrong when they're having vertigo. But it can also be drinking alcohol, taking drugs, both prescribed drugs and illegal drugs. One of the most common causes of vertigo, in fact, probably the most common cause of vertigo that's persistent, that lasts more than a few weeks, is either a head injury or a stroke. Post-concussion syndrome and concussions and closed head injuries can definitely cause vertigo, and they're actually a leading cause of it. Strokes or any type of injury to your brain, whether it's caused from a disease or something like a stroke, those can all result in permanent vertigo and dizziness. The inner ear and then dysfunctions with the brain, those are the main causes of dizziness and disequilibrium and vertigo. So if someone has that, when they're walking through their environment, they're not really getting all the information about their environment. They're thinking that the floor is moving, or they're thinking that they're moving when they really aren't. And all of the programs that are in our brain of how to move, how to walk, how to be stable in our environment, those programs are all dependent on knowing exactly where we are in space at every given moment. In other words, for me to move my hand smoothly from left to right, I literally have to know where my hand is here, 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 every single step. I have to know where my hand is in order for me to have smooth, coordinated movement. And if I don't know, then my movement's going to be jerky and all over the place. And that's what you see in a disease like Parkinson's, where someone really is denied that knowledge of where their limbs are. They develop that shaky tremor movement. If you don't know where you are every split second, it's going to throw your movement and your coordination off. And that's exactly what happens if you have vertigo, or if you have even just dizziness all the time. You can define dizziness as sort of just a sense that you're either going to fall or that you're off. And if you never had that sense, then I guess it's hard to understand. But so many people have felt that. I know I feel that when I get sinus infections, or if I have a really bad cold or a high fever. That's dizziness. And then vertigo is sort of a subset of dizziness, where you feel that the room is spinning or you're spinning. When someone has vertigo or someone has dizziness, they don't know where they are every split second, and that throws off all of their movement. Now, if the dizziness or vertigo is something very transient, like say it's because of alcohol or it's because you have a cold, generally those things can go away, and as long as you don't encounter them again, you're not going to be dizzy anymore. But for a lot of people, whether it's an inner ear disorder or a brain damage, they're having that dizziness constantly, and it doesn't go away. So it affects their balance, it affects their movement, and really the thing is to treat what's the cause of that dizziness in order to get rid of it, so the person can kind of go back to balancing as they normally are. So there are treatments for peripheral vertigo, or vertigo that originates from the inner ear, and that can be things like Epley's maneuver or the barbecue roll. There's a host of exercises that you can do, or activities you can do, to help move the crystals that might be in the wrong place in your inner ear to the correct place. Then there's also a number of things that you can do medically, like medication and antibiotics and even surgeries, to correct things like tumors or infections or labyrinthitis in the inner ear. A lot of times you can cure vertigo if it's originating from the inner ear, either with physical therapy or the interventions from the doctor. Now, if the problem is central vertigo from the brain, a lot of times that can be treated. And I know a lot of people, a lot of clinicians, a lot of physical therapists, and even doctors may not be aware that you can treat central vertigo, but there's a lot of research, especially in the last 10 years, that show it is possible to improve whole body proprioception and to reduce persistent vertigo through things like balance challenge training or gaze focus training. There's even something that I do, which is sort of like a higher level gaze focus training where you do it in standing, kind of off balance. And what I've learned is once you find a way to really challenge the vertigo and almost make the vertigo temporarily worse, or at least you elicit the vertigo, if you keep doing that, the person really can get better from it. There's never been a study that showed if there really is a change in the brain from doing those type of exercises, but there also hasn't been a study that showed it doesn't happen. I believe if someone does the research, they're going to find that gaze focus training or sort of higher level vestibular training really does change the brain, and the person really is relearning that skill of not only suppressing their dizziness, but actually knowing where they are in space and not getting dizzy in the first place. To do the standing dizziness exercise, you'll need a couple things. You want to have 2 chairs, one on either side of you, and then a sturdy chair behind you just in case you lose your balance and need to sit down. The other thing is you need something on the ground to look at, because you want to be able to look at something on the ground and focus on it, look at something straight in front of you and focus on it, and then look at something on the ceiling. So usually people have something on the ceiling they can look at and something out in front of them, but a lot of times on the ground there's nothing specific to look at. I like to use something like a piece of blue tape or an object like a ball. Now to do this activity, what you're going to do is you want to try to stand, if possible, in the heel to toe position. That means putting your right leg in front of your left and your toe is touching your heel. Now for a lot of people that might be too difficult, and it's fine if you want to spread your legs apart. You can even stand with your legs side by side if you find that that's the only way you can stand without holding on. Because to do this exercise, you can't be holding on to anything. You have to let go of everything. Now the directions are this. In this position, you want to let go of everything and then look down at the object on the floor, keep looking at it for 2 seconds, then look straight ahead, focusing on something for 2 seconds, and then slowly look up and focus on that for 2 seconds. Now, anytime you feel dizziness or disequilibrium, you want to keep looking in that direction until it goes away. Now, sometimes it'll go away in 3 or 4 seconds. Some people, it can be as long as 30 seconds for it to go away. The way this exercise helps you is by repeatedly practicing making that dizziness go away. That's how over time you'll improve and stop having this type of dizziness. But in the beginning, you might find that it's just overwhelming when you shift your head. Some people, when they look straight ahead, they're fine, and then when they look up, they're overwhelmingly dizzy and they have to grab onto the chair. Now, anytime you grab onto the chair, you want to switch legs. So if you're starting with your right leg forward and you lose your balance, you then want to grab the chair. Once the dizziness gets better, you want to switch legs. It's very important to never do this exercise if you're feeling overwhelmingly dizzy. If you're actually having vertigo or you feel that you can't stand anymore, you've done it too much. In a lot of people, this exercise can be made harder or easier by 2 things: where you place your feet and how fast you move your head. If you move your head fast, that's definitely going to make you more dizzy than if you do it slowly. So in some people, I just have to tell them to keep slowing down their head speed, because the object of this is not to make yourself dizzy. What you want to do is basically do it so that you experience that sensation of feeling disoriented, but only to a mild level. And then you want to keep looking in that direction until you can calm it down over and over again. Mild is the name of the game. You don't want to give yourself severe dizziness because it's just not going to get better. What you want to do is repeatedly practice changing your focus, feeling a little bit dizzy, and then calming it down by keep staring in that direction. And that's how people get better from this problem. So to do this exercise effectively, you want to do this for 5 minutes at a time. That means setting a timer, getting your chairs in place, and starting the timer by letting go of the chairs. And then do this for about 5 minutes. I find that this works best if you repeat it 5 times a day. So for 5 minutes, 5 times a day is the fastest way to improve this problem. But a lot of people don't have that much time, or they don't feel comfortable doing it that much. And I've seen people improve with this, doing it as little as twice a day. But you do have to do this every day for a few weeks to see this kind of improvement. I've worked with thousands of clients, and I've seen them with central vertigo get rid of it and not have this problem anymore. But it takes doing it about 5 times a day for a few weeks before you see that difference. I hope you found this video helpful. Click the subscribe button if you want to see more videos like this. If you would like more help with your balance, look in the description for a link to a course I created that can help anyone improve their balance at home.